It's Friday, May 21. This is the news on PBCJ. I'm Simone Absalom Gale. As the world continues the fight against the COVID-19 pandemic, vaccines are seen as the most viable path to getting the world back to some semblance of normalcy. Hoarding, supply logistics, and safety concerns are some of the factors that have hindered the global vaccine distribution. In our neck of the woods, there is a call for the expansion of the production of vaccines and medical supplies to reduce overdependence on imports and thus increase access to vaccines. That call comes from PAHO's director, Carissa Etienne, during the weekly virtual media briefing. The PAHO boss says less than 4% of the medical products in use during the COVID response have come from the region. The fact is illustrated by the region's dependence on imported COVID-19 vaccines.
We must ramp up production for the entire vaccine value chain, from the ingredients that go into vaccines to the vials and syringes that help us deliver them, without compromising quality.
Dr. Etienne says the region has the building blocks for expanded production.
Strong academic and research institutions, existing manufacturing capacity, robust regulatory systems, and an effective mechanism of procurement. Argentina, Brazil, Mexico, and Cuba have well-established vaccine manufacturing plants that have helped immunize generations of Latin Americans.
She says for this to work, regional members will have to commit to purchasing regionally made products. Dr. Etienne says PAHO stands ready to help.
Our revolving fund stands ready to help purchase and deliver these products throughout our region, as we have done for the last 40 years.
PAHO has been instrumental in COVID-19 vaccine distribution, delivering more than 12 million COVAX procured vaccine doses to countries in Latin America and the Caribbean. In related news, the Pan American Health Organization, PAHO, has strongly advised Caribbean countries not to relax entry protocols for travelers who are fully vaccinated against COVID-19. PAHO's Director of Health Emergencies, Dr. Seaga, says although inoculation against COVID-19 is ongoing, a large segment of the regional population still have not gotten the jab.
It is clear that the vaccine does not protect from getting infected, although there are increased evidence that that is the case in a significant proportion of persons who get vaccinated.
He warns that relaxing protocols for the vaccinated versus the non-vaccinated, even among the population, raises the issue of discrimination.
How can we discriminate or separate the persons who have been vaccinated from the other ones that get vaccinated? And also, if you are, for example, in a community where some people got vaccinated, how can you identify those and let them, for example, reduce their protective measures?
$237 million US. That's how much it's going to cost to connect 196 public schools to the internet. Science, Energy and Technology Minister Daul Vaz says it will be done under the National Broadband Initiative, which aims to have every household and every community connected to the internet by 2025.
The completion of the national communication backbone will allow the connection of 461 public entities, including 196 schools, 160 ministries, departments, and agencies, 62 major health facilities, 41 major police stations, and 11 Spectrum Management Authority sites. We will complete connectivity to the schools, as I said earlier, in the new school term, starting with the term which starts in September.
Vaz says this aspect will require simultaneous installation of microwave and fiber optic communication systems to ensure network redundancy and reliability.
Island-wide coverage provided by the National Infrastructure Communication Backbone will enable the use across all parishes of the following applications: the traffic management system, allowing connectivity for police station, courts, and tax administration, Jamaica. Colleague, the Amanda application. Central Treasury Management Systems, HR Management Systems, Shared Application Services, and last but not least, Jamaica Eye.
Today is National Children's Day. The theme for Child Month 2021 is I Strive to Overcome Adversities with Resilience. In a message to the nation, Prime Minister Andrew Holness urged all Jamaicans to renew their commitment to ensuring the well-being and holistic development of all our children.
Nelson Mandela said, "There can be no keener revelation of a society's soul than the way in which it treats its children." May is Child Month, dedicated to the celebration of our children and heightening our focus on the need to love and protect them. And today is National Children's Day. On this very special day, I urge all Jamaicans to renew our commitment to ensuring the well-being and holistic development of all our children.
He noted the challenges placed on our children owing to the COVID-19 pandemic.
Our children have been significantly disrupted in their usual routines over the past year, including the suspension of face-to-face classes, limited play and social interaction through the need for social and physical distancing measures. They have had to adjust to new ways of learning, new ways of socializing with relatives and friends, and new ways of celebrating significant life events. These unexpected changes to their day-to-day lives may have resulted in increased levels of stress and anxiety. Parents and caregivers have a vital role to play in teaching our children the strategies to cope and thrive in these unusual circumstances. We must provide them with accurate information, help them to establish new routines, and provide a safe space for them to discuss their anxieties and challenges. Our children look to us for direction. They will mirror our actions and our energies, so we must remain calm and model responsible behavior. We must frequently remind our children to stay safe by following the public health guidelines to wash hands often, wear masks in public places, and maintain physical distance.
The Denham Town Infant School and the Denham Town Primary School are to be renamed in honor of the late Prime Minister and former West Kingston Member of Parliament, Edward Seaga. Education, Youth and Information Minister Favour Williams made the announcement at the post-Cabinet press brief on Wednesday.
So Cabinet gave approval for Denham Town Infant School and Denham Town Primary School in the constituency of Kingston Western to be renamed the Edward Seaga Infant School and Edward Seaga Primary School, respectively. The government has established a tradition of honoring distinguished Jamaicans who made sterling contributions to national development and the advancement of the Jamaican people through their chosen fields of endeavor. Mr. Seaga served with distinction as Member of Parliament in the constituency for 43 years. During the course of his political life, Mr. Seaga made a significant impact on Jamaica's growth and development through the introduction of various programs and the establishment of institutions across the social, cultural, political, and financial sectors.
Mr. Seaga served as Jamaica's 5th Prime Minister from 1980 to 1989. He retired from political life in 2005 and died on May 28, 2019. The recent increases in gas prices and the online applications for GCT status. These are some of the stories being tracked in today's extended edition of the Business Report with host Gabriel Thompson.
The Tax Administration Jamaica TAJ is advising that the application for the Registered General Consumption Tax GCT status can now be done online. The application is accessible through the tax portal at www.jamaicatax.gov.jm and now forms part of the tax authority's increased suite of digital services. The TAJ says 78 applications have been received using the new service since the April 2021 implementation. Business persons or entities or their representative with the appropriate access to their e-service account can now make an application for registered GCT status using the online application process. In order to do so, they will be required to meet at least one of the following criteria: be involved in the manufacture of prescribed goods under the GCT Act, be involved in a GCT taxable activity with gross sales exceeding $10 million per annum for the period preceding the application, be involved in the activity of motor vehicle trade, or meet any other requirement set out in the GCT Act. Taxpayers are further advised to take note of the documents and information needed when making their applications via TAJ's website. Once the electronic application has been submitted, it is then reviewed by a TAJ officer, and if approved, the GCT account will be made available through the taxpayer's e-services account, enabling them to make future payments and filings for GCT. If the application has been rejected due to the requirements not being met, a rejection letter will be issued via the applicant's e-services account detailing the reason or reasons for the rejection. Customers may access information in the How-To section of the website at www.jamaicatax.gov.jm on how to register for GCT online, as well as how to file a consumption tax return online. For further information, call the Tax Administration Customer Care Center at 888-TAX-HELP. That's 888-829-4357, or visit the website. In Thursday's trading session, the JSE Combined Index advanced by 2,538 points to close at over 426,000 units. Overall market activity resulted from trading in 93 stocks, of which 41 advanced, 39 declined, and 13 traded firm. The Junior Market Index advanced by 2 points to close at over 3,000 units. Stocks advanced for 138 Students Living Jamaica Limited, Access Financial Services Limited, and Burrito Investments Limited. Stocks declined for 1834 Investments Limited, AMG Packaging and Paper Company Limited, and Cargo Handlers Limited. Trading firm were 138 Student Living Variable Preference, CAC 2000 Limited, and Caribbean Cream Limited. Future Energy Source Company Limited ordinary shares was the volume leader with over 15 million units, followed by JMMB Group 7.25 preference shares with 8.9 million units, and the Sagicor Group Jamaica Limited with 7.2 million units. In foreign exchange trading for Thursday, May 20, the US dollar sold for an average $150.25. The Canadian dollar ended trading at $124.76. The pound sterling traded for $213.63, and the euro sold for an average $186.24. And in market data for oil, Brent crude futures gained 90 cents or 1.38% to settle at $66.01 a barrel. West Texas Intermediate crude added $1 to $62.94 a barrel, an increase of 1.61%. Both contracts suffered losses in previous sessions. Financial success coach Denise Williams says when persons need support in credit restoration, credit repair, or debt healing, there's usually more to the story than a credit card bill or some loan that they can't manage. In this week's edition of Financially Focused, Denise shares the story of Sandrine, a woman who used her credit card to pay for her husband's 2 funerals. Denise also makes the case for credit restoration certification, particularly in the Caribbean.
Now, one of the reasons why she came to me is because she had heard my story. My son is an awesome 11-year-old boy, and he was born with Down syndrome, and there was a lot of medical bills that came with the early years of his life. He had a heart condition. He had respiratory issues, and the medical bills just racked up. But that said, her husband, and we are talking about persons in the Caribbean, let me be very clear. So Sandrine's husband had gone on a farm work program, and decided to stay in the Toronto area with the plan to eventually, do the paperwork to send for Sandrine and the children from Jamaica. Okay, so the farm work program, again, for persons who may be watching globally, is a lot of persons from the Caribbean take jobs on farms in North America, Toronto, Canada, or certain like Maryland in the US, Virginia in the US, in order to supplement their income. So, a standard employment practice. Sandrine, however, had a corporate job and she didn't really have a pressing desire to leave Jamaica. So she wanted to stay here. So essentially the husband went, the wife stayed, all was well, right? How did this get into a credit repair story? Okay. Thing is, Sandrine's husband died in Toronto and she knew he wanted to be buried in Jamaica. So she used her credit card to pay for everything. The funeral in Toronto for friends and family there, the shipping of the body to Jamaica, and then a second funeral in Jamaica. Sandrine had been encouraged by family members to do this two-country, two-funeral show because, promises were made for money to support her in this time of grief. So additionally, Sandrine, because of her corporate position, she was offered a highly exclusive Black credit card with a high credit limit to cover the funeral costs. A bill collector calling you is a sign to change your life, and a free credit report is yours for the asking. So with the credit collector calling you, the bill collector calling you, and you have the right to your free credit report, what does that mean? How does that help? Well, the coaching that we did with Sandrine did help her to clear off the balance in 6 months. So she was able to get a grip on her emotions and she was able to see where she could renegotiate and make concrete steps to just get rid of this balance. I will say one of the things that has come out of this journey of helping persons understand what's going on is a realization that in the Caribbean, we do not have credit restoration professional certification. Now, let me be clear, attorneys, lawyers, these are awesome professionals when your situation requires court intervention. But a lot of times, the gap between what you can do for yourself and then what needs to go to court is huge. And you really need a professional who can walk you through that. I'm really happy to know that Financially Focused has partnered with the Caribbean Credit Repair Association, and we're looking at how credit card debt is managed and the impact on the credit report, as a vital part of the credit restoration professional program. It's no secret that credit card debt is one of the most expensive debts you can access. And, in Jamaica and in the Caribbean, banks charge as much as 60% interest on the balance. So if you have a plan to quickly pay down a credit card debt, or you're going to use your credit card to access some profit-making activity, you have my blessings. Go ahead, use the card. However, as we said, if the bill collectors are running you down, this is a big sign. You're gonna need to make a change in your life. And this is where the credit restoration help. At the time when my son was born with his medical condition related to Down syndrome, there wasn't anyone for me to turn to for help. If you are in credit card problems, it is really time to do something different. I implore you not to allow emotions to get, in the way. So if you want to take action on your own, you're not in a position to pay a credit restoration professional, close your credit card account, cut up the card. Okay? Write a letter to the bank telling them that you're closing the account and you want to negotiate a payment term. Okay? So just stop. It may be easier said than done, and especially if the credit card is what actually supplements your salary. So again, I would recommend you get some counseling if that's the situation. But you can write to the bank, you can close your credit card, and you can renegotiate a repayment of what you owe. So you are empowered. You can take action. And it's something that I would immediately recommend that you do.
Thanks, Denise. For more information on the development of your financial future, head on over to financiallyfocusedmedia.com or find Denise on YouTube at Financially Focused. And on that note, we close this extended edition of the Business Report Inside the News on PBCJ. I'm Gabrielle Thompson.
In regional news, 16,000 additional AstraZeneca vaccines arrived in Trinidad and Tobago Thursday afternoon. The country's Minister of Foreign and CARICOM Affairs, Dr. Amory Brown, said the vaccines were donated by Prime Minister of St. Vincent and the Grenadines. He also confirmed that Bermuda has pledged vaccines to the country. Kimberly D'Souza of TTT News reports.
Trinidad and Tobago continues to benefit from additional donations of the COVID-19 vaccines, as St. Vincent and the Grenadines have donated a batch of the AstraZeneca vaccines to the country. Speaking at the post-cabinet media briefing on Thursday, Minister of Foreign and CARICOM Affairs, Dr. Amory Brown, announced that the Prime Minister of St. Vincent, Dr. Ralph Gonsalves, has given this country 16,000 vaccines.
These vaccines will expire at the end of June, and the Ministry of Health has indicated that they would have sufficient time to ensure that they are fully and properly utilized for the benefit of the people of Trinidad and Tobago.
While the vaccines will expire in June, he gave the assurance that there will be no wastage, as our local health officials will ensure that all are used.
They've programmed the expiration dates of the various vaccines into their vaccination rollout schedule, already including the currently considered donations, the ones that are coming in today and next week. We do not anticipate wastage of a single vial.
During the briefing, Dr. Brown added more good news, a donation of 8,000 AstraZeneca vaccines from Bermuda.
The details of the conveyance of those vaccines to Trinidad and Tobago are being finalized as we speak. We anticipate they will be within our jurisdiction very early next week.
He said the government is diligently working to ensure that the country and other member states within CARICOM receive some of the 80 million doses pledged by U.S. President Joe Biden. In the past, the country has received donations of vaccines from China, India, and Barbados. Kimberly D'Souza, TTT News.
St. Lucia's COVID-19 numbers appear to be heading in the wrong direction, with public health authorities warning of a possible outbreak if the population fails to take heed of the pandemic safety measures. Epidemiologists at the Ministry of Health provided details of a breakdown in the rising caseload, which is cause for serious concern. We get more in this HTS News Force report.
The overriding message from Tuesday's hour-long media briefing by top executives of the Ministry of Health was simply, St. Lucia is not out of the woods as far as COVID-19 is concerned. The month of May saw a sharp rise in COVID-19 cases and deaths, a trend that began at the end of April. National epidemiologist Dr. Michelle Francois says it's all heading in the wrong direction.
Over the last 28 days, we've had 414 cases. This is of significance to us because if we look at the CDC travel the guidelines indicate that over 100 cases is considered very high risk. So we pay particular attention to this because we need to know how we are classified and how we can adjust our measures to ensure that we are not in the criteria of very high risk.
The month of May is particularly telling with the numbers trending upwards. Dr. Francois warns that there's as great a need as ever for adherence to the protocols of social distancing, mask wearing, and the washing and sanitizing of hands.
So we've had almost 20 cases a day, and this is between May 5th to May 18th. We've averaged 20 cases a day, and that has not changed for the past 14 days. If we look at our 14-day average, we have gone from 12.6 cases per day to 19.8. So in terms of that, we have moved from April 21st to May 4th, from 6.9 to where we currently are at 10.9. So there is some increase in activity in terms of the number of cases being diagnosed on the ground. And in terms of community transmission, if we go by the Centers for Disease Control, what we notice is that we are now at substantial transmission. In terms of the total new cases per 100,000, substantial transmission would be 50 to 99. So we are not moving in the correct direction. We have been increasing cases, and this is of concern, particularly with the new variants of concern that have been diagnosed.
COVID-19 fatigue among the population seems to be setting in just at a point when the situation is becoming more complicated, with new variants being recorded.
As of May 14th, we have started climbing in terms of the number of cases. Now, with the circulation of variants within the region, within the world globally, with WHO now declaring another variant of concern in India, this is particularly concerning as we have started increasing, and we know that some of our member states have at least 3 variants to date.
Just when it seemed that St. Lucia was on the verge of turning the COVID-19 situation around, comes a rise in cases and deaths, with a population increasingly demonstrating unwillingness to adhere to the rules that are meant to keep the COVID-19 situation under control or to be vaccinated. The health authorities have the making of a mammoth challenge on their hands. Stanley Lucian for the HTS News Force.
In sports, the International Olympic Committee's longest-serving member, Richard Pound, assured on Thursday that the Tokyo Games are a go. As officials and local organizers held online talks, Pound was quoted saying, "Based on everything we know today, it's a go. I have my ticket. If the host country doesn't want to host, it doesn't host." End quote. He added that the IOC ultimately retains the power to cancel the games if the conditions are dangerous enough. Japanese public sentiment against the mega event, with polls showing a majority in the country want the Olympics delayed further or altogether cancelled. Organizers have outlined extensive virus countermeasures to keep the Olympics safe, including barring overseas fans for the first time ever. But with Japan battling a 4th wave of infections, doctors' associations have warned that the healthcare system is already overstretched. And with games, it should add further stress. The games begin in 2 months' time. And in other sporting news, 7 medical professionals have been charged with homicide in the death of soccer legend Diego Maradona. According to ESPN Sports, Maradona died in November, 2 weeks after having brain surgery. He was 60. Following Maradona's death, an investigation was launched. Prosecutors charged 7 people in the death, including his newest surgeon. Prosecutors have asked that the individuals charged with homicide not be allowed to leave Argentina. Prosecutors also had a medical board review the actions of Maradona's medical team to determine how it handled the situation. The medical board found that Maradona's medical team acted, quote, in a reckless manner, end quote, with Maradona. Members of the medical team, including 2 nurses, a nurse coordinator, a doctor, and a psychologist, were also charged in Maradona's death. If found guilty, those accused could face 8 to 25 years in prison. And that's all we have for you today. You've just watched the news on PBCJ. Pleasant viewing.